Welcome to our Neuroslimming webinar finale. Welcome everyone. Thank you for your enthusiastic participation over the last 18 months, pretty much it's been. It's been such a pleasure having you. So tonight, some really important topics, possibly life-saving topics. Firstly, what is the most important test that you can have to tell you whether you're healthy or not? We're going to cover diabetes and NAFLD, and I'll explain what that is because so many participants have asked about it, and they are the biggest epidemics in our country and in the Western world today. What's the keto diet everyone's talking about? Is it the same as low carb? What's keto? What's low carb? All of that confusion I will clear up, and we'll finish with a brand new weight loss device, and you're not going to want to miss that. Okay, so let's start with a poll question. Poll number 1, Craig will put it up. Which hormone is associated with the most problems? Very good. Insulin is the correct answer. Yes, all of them can go wrong and all of them can cause health problems, but insulin by far the greatest. So well done. So if you close that, excellent. All right, so it being a possible big problem, what is insulin? Insulin is a hormone produced by an organ called the pancreas, which is 12 to 15 centimeters. It's in our left upper abdomen and it sits behind the stomach. What does insulin do? I've highlighted the in red to indicate that insulin is produced whenever we eat carbohydrates, and I'll explain what they are in a moment. And it allows those carbohydrates, well, actually I have to explain a little bit about carbohydrates straight away. Carbohydrates are made up of simple sugars. So if you think of a carbohydrate as a wall made up of bricks, the bricks are either glucose, fructose, or galactose. They're the simplest form of carbohydrate. And all carbohydrates are made by either combining glucose with glucose, or glucose with fructose, or glucose with galactose. So if you think of glucose, fructose, and galactose as the bricks and carbohydrates as the wall, whenever we eat a carbohydrate, it is broken down into glucose, fructose, or galactose. And those three enter the bloodstream. And glucose is the energy that is used, is the form of energy used by every cell of our body. But it requires insulin to enter the cell. So insulin acts like a key, and it unlocks the door in every cell of our body to allow glucose in, to allow that cell to have energy to do whatever it is that it needs to do. It's known as an anabolic, so that's why the in. Insulin allows glucose into all our cells. It's called an anabolic hormone because it builds up all our organs. It allows them all to grow. So insulin makes fat cells grow. It makes, muscles grow. It makes all our organs grow. And it also stimulates our hunger. The reason being, it clears the glucose from our bloodstream, and, low glucose levels are one of the things that stimulate hunger. Okay, so given that I've explained what a carbohydrate is in terms of bricks and wall and biochemistry, but what are carbohydrates in terms of our food? I just want to see where everyone is at. So next poll question, tick which one of the following are carbohydrates. There should be 10 options there. Actually, every single one of them is a carbohydrate. Thank you. You can close that screen. And the reason I asked that question and put that up there is because not a lot of people, everyone knows that bread is a carbohydrate, just about. Pasta is a carbohydrate. Rice is a carbohydrate. Not everyone knows that all fruits are also carbohydrates. They ultimately break down into glucose and fructose. And as a general rule of thumb, every plant food and everything that is made of any grains, breakfast cereals, every plant food contains carbohydrates to a greater or lesser degree. Milk also contains carbohydrates in the form of lactose, which breaks down into glucose plus galactose. So all milk products contain carbohydrates to a greater or lesser degree. Not as much as a potato, of course. There's about 4 grams of carbohydrate per 100 grams, 100 milliliters of milk, roughly. And obviously, if the milk product has flavoring, is a chocolate milk, obviously it's going to have a lot more carbohydrate. And also alcohol contains carbohydrates. Beer more than white wine, more than red wine. So just aware that a great deal of what we are eating contains carbohydrates. But not all carbs are created equal. Eating a plate of vegetables and high fiber grains and fruit has a completely different effect to those Fruit Loops or whatever that garbage is on the other side of the screen. A completely different effect. So the reason being the fiber and water content. You see, nature knows what it's doing. When nature created a carbohydrate, it packaged it with fiber and water, both of which slow down the rate of absorption to allow insulin to do its job, to allow the glucose to be distributed, and to allow all our cells to be happy. But when you eat that garbage, colored stuff, it's just pure glucose and fructose. It enters with no fiber, no water in the actual thing. It enters our bloodstream extremely quickly. The insulin gets spiked enormously because there's so much glucose in our bloodstream. To get rid of it, you have to produce a lot of glucose. Now you might say, well, so what if there's a lot of glucose in our blood? High glucose levels can damage all our organs. That's why the body needs to keep our blood sugar levels. Blood glucose and blood sugar levels are one and the same. So it needs to, but blood glucose is the more precise term. We need to keep our blood glucose levels in tight control, because if they're out of control, kidney failure, nerve damage, it's the biggest cause of amputations, preventable blindness. So you don't want to have very high glucose levels in your blood for any length of time. So that's why insulin is so important. Now, someone's going to ask me about glycemic index and glycemic load, but glycemic index was simply a measure to indicate how quickly and how much your blood glucose is going to spike after eating something. So glucose has the highest glycemic index because it's the pure thing. So it's got a glycemic index of 100 and it spikes your insulin more than anything else because it's the pure thing. And so something like celery, which has a lot of fiber, even though it contains carbohydrate, it doesn't give it as much, nowhere near as much of a spike, because you've got all that fiber and all that water that slows down the absorption. So it's not going to cause havoc with your insulin, like spiking along with the glucose, because every time your glucose spikes, so does your insulin. However, it's not just, the amount of, how much it spikes and how quickly, it's also how much total carbohydrate the food contains. And that's where glycemic load comes in. It's a measure of the glycemic. It takes into account not just the speed at which you spike, but how much total, for how long it's going to stay up because of the amount of carbohydrate in the whole food. But I actually think both these measures are not very helpful because, number one, everybody's different and different foods cause different people's blood sugar to spike at different rates. It's really interesting. We just all respond to things differently. And we also don't eat foods in isolation. You're never going to have pure glucose. You're never going to have, you rarely, sometimes you might eat celery on its own, but rarely. We mix up foods and that all influences the speed and the rate at which glucose is going to enter our bloodstream and the speed and the rate in which it's going to stimulate glucose. So I mentioned them for completeness, but I personally wouldn't worry about them too much. And the other components of our diet are proteins and fats. How do they affect insulin? Fats do not affect insulin at all. You can drink pure fat, not that you would, but you can, and it doesn't influence your insulin at all. Fat does not need insulin in order to enter the body to be redistributed and to do its job. Proteins, to a much, much smaller degree than carbohydrates, will also cause a small rise in insulin, but it also depends what you eat those proteins with. So generally, we don't think of proteins as carbohydrates as raising our insulin level. But if you were to eat just pure steak, steak after steak, yeah, that would raise your insulin a little bit. Okay, so what can go wrong in relation to insulin? The three major things. Type 1 diabetes. This is not that common. This is where a person is actually born with, we think it's related to genetics, it's related to gut microbiome, and it's related to an autoimmune condition. But in type 1 diabetes, the beta cells in your pancreas simply cannot produce insulin. It's really an unlucky thing to be born with. So that's what type 1 diabetes is. You are not producing insulin. Therefore, whenever you eat glucose, what's going to happen? It just stays in your bloodstream. Now, your kidneys, and remember, we don't want high glucose levels. The kidneys do their best and they try and extract the glucose and you pee it out. And that's where the name comes from, diabetes, sort of sweet urine, because that's how it was first diagnosed. Doctors used to taste people's urine, and if it was sweet, they had diabetes. But that's not enough. You have to, in order to, allow a type 1 diabetic to survive, you have to give them injectable insulin, and they have to inject insulin every time they eat a carbohydrate meal. And that's okay. You just sort of balance it and they can live a normal life. Type 2 diabetes, and when we talk about pre-diabetes, we're talking about pre-type 2 diabetes, is a completely different condition. The only thing that type 1 and type 2 diabetes have in common is that they can both lead to high blood glucose levels. But in terms of the mechanism, it's completely different. What happens with type 2 diabetes, pre-diabetes? If a person eats a lot of sugar and carbohydrates every meal, and particularly the simple carbohydrates, the unrefined grains, the ones that are low in fiber, low in water. So we're talking breakfast cereals, white bread, white pasta, white rice, and any snack foods are just loaded with simple carbohydrates and simple sugars. If you eat a lot of those meals, what's going to happen? Well, I've told you, every time you eat a carbohydrate, glucose rises in your blood, so the pancreas has to produce a corresponding amount of insulin to remove the glucose from the blood and have it enter all your cells. But your cells can only take so much glucose. Glucose, when it enters the muscles, that's the greatest place that all your glucose goes. It'll use it for energy. It'll store it as glycogen. So basically it takes in the glucose and it reconnects the glucose to form glycogen, which is just lots of glucose molecules attached to one another. So it stores it as glycogen so that after you've, rested, haven't eaten for a while, you can still go for a run because it's got it'll use up the glycogen. And if you eat to excess, it will convert some of it to fat and you'll have a bit of fat in your muscle. It's no big deal. The liver does the same. It takes in the glucose, converts it to glycogen, and it has a much greater capacity to convert excess glucose into fat. But then you get a fatty liver, and the rest of the rest of the glucose is taken in by the liver and converted to fat and sent back out because the liver can't carry that much fat, so it sends it out back into the blood as fat, which is then taken and stored in your fat cells. So that's why eating excessive carbohydrates will increase your body fat because it gets converted into body fat, unless you are an athlete, a marathon runner, and you're burning it up all the time. So it's about eating more than you actually need. So pre-diabetes is the state where, another name for it is insulin resistance. And what it is you are constantly needing insulin. This is the key. And so the cells are going, but I can't take any more glucose. I don't want any more glucose. So what do? The cells of your body start to become resistant to the insulin. It's like creating more locks. You don't want somebody's got the key to your house and you go, look at that, I'm going to add more locks so they can't get in. So your cells metaphorically speaking, produce more LOX so that the pancreas goes, far out, one key is not enough. I've got to produce more keys to get the glucose in. So that's why your pancreas produces more and more insulin. And because it needs more than the expected amount of insulin to get glucose out of the bloodstream, it's called insulin resistance. We call it insulin resistance. We're saying, oh, your cells aren't responding properly to insulin. Yes, they are. They've just had enough. And if it gets to the point where you just continue to a high carbohydrate diet, the pancreas will continue to make more insulin. After a while, it just goes, I can't make any more insulin. And that's when pre-diabetes becomes diabetes, because that's when your pancreas now stops making enough insulin, and you now, like a type 1 diabetic, have to get insulin injections as well, or you can take various medications that help you jam more glucose into your cells, but you really don't want that. So how do you treat carboholism? And the reason I have used the word carboholism, I've made this up. Let me ask you another question. How do you treat an alcoholic? What do? The only way to treat an alcoholic is to get them to stop drinking alcohol. The only way to treat pre-diabetes, and it's not the only way, but it is the simplest and most logical way. It is so simple and easy, a 4-year-old could tell you if you told them how it worked. How do you stop type 2? How do you cure type 2 diabetes? How do you cure insulin resistance? You stop eating carbohydrates. You give your body a break. And this is where people start to get confused about low carb diets. But high fiber is good. But, fruits and vegetables are really good for you. Yes, they are, as long as your body is working properly and you haven't oversaturated all your organs with glucose. But if you get to the point where you're insulin resistant, you've just got to cut out all carbohydrates for a while in order to allow the insulin in your blood to drop, the cells to start to release some of that stored fat and stored glucose. And then your pancreas will start to make its insulin again, and you're back to normal. So, okay, what I've told you that insulin resistance can lead to type 2 diabetes, but it is just one of many, many, many things it can do. And the reason for that is, remember I told you, insulin affects every cell of the body. It unlocks every cell to allow glucose in. So with that as a sort of lead-in, what's the next? I'd like to ask another question. Which of the following do you think can result from insulin resistance, as in too much glucose?
Before I put that up, there's an interesting question here, and I think timing is of the essence here.
Yep.
So what about for vegetarians? If you were bringing back your carb load, obviously veggies have got carbs in them, and if they're eating vegetarian, do they just eat tofu?
No. If you're a vegetarian, it's a simple rule. You can eat all above ground vegetables, because I told you, like, it's eating spinach has negligible, yes, it's got carbohydrates, but 1 cup of spinach is 1 or 2 grams of carbs. And when I say cut out all carbs, in order to drop your insulin enough, you could still eat 20 grams of carbohydrates. That still allows you every green vegetable in existence. Basically, you don't have to make it complicated. You can eat all above ground vegetables. So the only vegetables you can't eat are potatoes. You can't eat your rice or your pasta or your bread. You can eat your onion and your garlic, just don't go overboard, but who would? And
carrots.
Yeah, you can even eat a few carrots, but it's largely the starchy vegetables. So I wouldn't eat pumpkin, and I wouldn't eat any type of potato, and I certainly wouldn't eat rice or grains. But you can eat all the other, and you wouldn't eat any fruit, but you can eat berries because they're very, very low in carbohydrates. But 1 apple, for instance, 15 grams of carbs. 1 banana, 20 plus grams. 1 orange, 10 plus grams. So you can see even 1 or 2 pieces of fruit is already going to get you pretty high. But you don't have to do this forever. You just have to lower it for long enough to kick things back into action. Okay, so you can eat all your vegetables above the ground, but you can't eat your beans either, because that tends to have quite a lot of carbohydrates. No beans or legumes for that limited period of time. So what can insulin resistance lead to? Not everybody's going to get it necessarily, but yeah, what can it be associated with?
Yeah. How long do you reduce that load of carbohydrate?
Everybody is different, but it's much quicker than you realize. I have had patients within 24 hours, they have reduced the amount of insulin they need. Within 5 days, are totally off insulin. Okay. So as I said, it's definitely not as long as you think it is. And then you very slowly reintroduce carbohydrates to find your carbohydrate tolerance. It's very much like an alcoholic. Some people can drink, get tipsy, get drunk after 1 or 2 drinks. Some people can hold their liquor better. So and they can drink 5. I still don't recommend you overdrink, but they just don't get drunk very quickly. And the same with carbs. Some people can tolerate only a few carbs. Some people can tolerate a lot more. That's where you go, but not everybody who eats too many carbs gets insulin resistance. No, not everybody who drinks a lot of alcohol is an alcoholic either.
Yeah.
So it just depends. But as I said, in 5 days, I have had people go off all medication if you catch them early enough. And the answer to this poll is every single one of those, and if you could leave it up for a minute, every single one of those things is affected by insulin resistance. And that's because, I'll just give you I won't go through them all, but I'll just give you a clue. With high blood pressure, why does insulin resistance lead to high blood pressure? Remember I said insulin causes things to grow, including the inner lining of your arteries. So if you've got the inner lining of your arteries being hammered with insulin, they start to thicken, and that will increase your blood pressure. Insulin also causes more salt to be retained by its action on the kidney. So without eating more salt, you're retaining more salt. So that's another reason why insulin resistance leads to high blood pressure. As an extension of that, heart disease, stroke, erectile dysfunction, again, because it's affecting the blood vessels and slowing down the entry of blood into your man's penis, hence erectile dysfunction. Polycystic ovarian syndrome, insulin stimulates the ovaries to produce cysts, hence the polycystic ovarian syndrome. Because insulin resistance causes liver inflammation, which can lead to the production of uric acid, that can then lead to gout. I can't see the rest, but can you see how, because insulin affects every organ and cell of the body, too much insulin causes things to go wrong with pretty much every organ.
The next one was Alzheimer's.
Okay. Alzheimer's is actually called insulin resistance of the brain, or type 3 diabetes. And that's because your brain desperately needs more energy than anything else. And if your brain cells now are overloaded and can't take in any more energy, disaster. If you don't have the energy to think well, everything falls apart. So they've actually shown that if you spray insulin into the nose of somebody with Alzheimer's disease, they improve temporarily because you're jamming more glucose into the cell, but you're not curing them. It's just a proof of concept. Did that make sense? Yeah. Okay. Since we mentioned stroke, can you somehow get rid of that poll answers? Yeah. Since we mentioned stroke, this is the doctor in me coming out. How many of you have heard the acronym FAST? How do you spot a stroke fast? It's an acronym for the 4 major signs of stroke. I want you to actually answer that. Do you know what FAST stands for? And it is, you could save somebody's life knowing this.
Okay, let's see what face, alignment, strength, time.
Very good. I would pay all of those, but I've got
face, arms, strength, tongue, or face, arm, speech, time.
Very good. Very good. I'd pay all of that, but I'll just tell you what the official acronym is. Facial droop, arm weakness, slurred speech, and time to call 000. Personally, I would add that T. I would also say terrible headache, trouble walking, trouble seeing, tingling or numbness in one half of the body. So that's just a life-saving thing. It's worth remembering. The official one is, the facial droop, the arm weakness, the slurred speech, and time to call 000, because time is of the essence. There you go. All right. So now we know that what can the trouble you get into if you have insulin resistance. What causes insulin resistance? Next poll. Okay, you should know me by now. All of the above. Now, it would take 10 webinars to get through the mechanisms, the pathways through which each one of these things contributes to insulin resistance. So I'm just going to go through it really quickly. Once again, it's not just this vague, oh, we've seen an association. No. There is a biochemical pathway. Eating too much sugar, because if you eat too much sugar, you're you're raising your insulin too much all the time. Same with refined carbohydrates. Why eating or cooking with seed oils? Because they cause inflammation, particularly in your liver, which then makes it insulin resistant. So any inflammation in the body, if you look down, chronic infections, just cause you to be insulin resistant, because with inflammatory chemicals floating around, they antagonize the effect of insulin on your organs. Sleep deprivation and chronic stress, they raise the hormone cortisol, which has the opposite effect to insulin. So you need more insulin to exert its effect. Sedentary living also raises inflammation, which makes your organs insulin resistant. Smoking is an interesting one, where they've actually done, I don't know how they got away with such unethical experiments. This is a long time ago, they got a couple of men to just smoke 4 cigarettes an hour, 4 cigarettes an hour every day for 4 days, just the 4 cigarettes, and then they wouldn't smoke, then 4 cigarettes the next day and the next day. And they found that their insulin rose in response. And when they ate a meal, they got a higher, more insulin produced than it otherwise would have. So that's why there are so many things that contribute. However, by far and away, the greatest contributor, the greatest cause of insulin resistance is eating too much sugar and too many refined carbohydrates. All the other things are complementary, just make things worse. And that's why, some people can get away with, say, eating more sugar, because if they exercise a lot, if they sleep really well, if they've got no stress, then they haven't got anything else that's working to push their insulin up. Other really important contributors that weren't on the list, all these things can also increase your risk of insulin resistance. Shift work, because it's mucking up your circadian rhythm, and insulin follows circadian, meaning the daily pattern of hormone output, and so it mucks up the insulin output. Sarcopenia means muscle loss, and this is why one of the best things you can do to make your body more insulin sensitive is do weight training and strength training. Going for a run, walk, aerobic exercise is fantastic, because you're using up the glucose. Your muscles are soaking it up, burning energy, great. However, the more muscle mass in your body, the more, it's like having more rooms in your house to fit stuff. So the more rooms in your house, the more stuff you can put in, the more muscle you have, the more glucose it'll take in a healthy way. Snacking, because if you're constantly eating, you're never going to, most people do not snack on a tin of tuna or lettuce leaves and olive oil, which would not raise your insulin. If you're going to snack, it's usually a carbohydrate. So snacking means you're constantly producing insulin all the time. You're never dropping it down. Menopause, because estrogen helps you remain insulin sensitive. So if a woman is borderline, not quite insulin resistant, but borderline, when she hits menopause and has a drop in her estrogen levels, that can then tip her over the edge into insulin resistance. And MSG has also been found to raise insulin. So it's not a carbohydrate, but so it's just another thing that can have an effect. Okay, so how do you know if you're insulin resistant? What are the symptoms? What are the clues? What are the signs? The answer is every single one of those is a sign. Now, some, again, more than others. Not everyone carrying excess body fat has insulin resistance, but 90% of people will. And what does that mean? Women with a waist circumference above 82, I'd start to think there might be some insulin resistance there. And men over about 96, I'd start to think about insulin resistance. If somebody's constantly feeling hungry, what that possibly means is, you're constantly producing insulin. Your blood sugar's going up and down. That sort of reeks, insulin makes people feel hungry. So if you've got a lot of insulin on board, you're going to be feeling hungry. Why skin tags and patches of dark velvety skin around your neck, armpits, or groin, which is called acanthosis nigricans? Because remember, insulin causes everything to grow. So it affects your skin, so you're going to get skin tags. It also causes the pigment-producing cells in your skin to produce more pigment. So you get these dark patches, and it happens to occur in the creases of your body more than anywhere else. High blood pressure and insulin resistance go hand in hand. And there are dramatic drops in blood pressure when people, once again, drop your carbohydrates to 20 grams a day, and you will see your blood pressure drop within a week. It's just amazing. High blood triglycerides are also, and low HDL cholesterol, which for simplicity we'll call it the good cholesterol, they are also very telltale signs of insulin resistance. I can't see any lower than that.
Abnormal liver function.
Oh, yes, definitely abnormal liver function tests, which are just going to be picked up on a routine test. So they might be a bit vague, but if you've got two of those things, I would put money on the fact that you have a degree of insulin resistance. Okay, moving on. So acanthosis nigricans, that's just to remind that's the dark patches of skin. That's a really strong telltale sign. Other things can cause it, but not many. The most common cause of acanthosis nigricans is excessive insulin production and type 2 diabetes. Okay, the liver I've been asked about, and this is a really, really important thing to know because this can be lethal. Insulin causes fatty liver. Sorry, hyperinsulinemia, too much insulin in the blood, insulin resistance causes, remember, the liver is turning all that glucose into fat. So you get a fatty liver. So what? You got a bit of fat in your liver. So what? It's really important. Let me first tell you what NAFLD stands for. It stands for non-alcoholic fatty liver disease. This didn't exist about 30 years ago because all liver disease was alcoholic fatty liver disease. Alcohol does the same thing, gives you a fatty liver. And, half a century ago, the only people who got fatty liver disease were alcoholics, which can then progress to cirrhosis, fibrosis, cirrhosis, and either liver cancer or liver failure. This, about in the 80s, 90s, we started to get an increase in non-alcoholic fatty liver disease. In other words, something other than alcohol was causing it. And the biggest cause, the single biggest cause, is excessive soft drink consumption, excessive sugar consumption, or anything that's just got all your sweet foods, and excessive refined carbohydrate consumption. And you can cure your non-alcoholic fatty liver disease just by doing that. Drop your carbohydrates to 20 grams a day. And why does non-alcoholic fatty liver disease matter? 1 in 4 people have it, and most of them don't know. How do you pick it up? It's a silent disease until it gets really bad. And really bad means you start to have your liver malfunctioning, you get jaundiced, maybe you get tired, but it's a really vague thing. You're only going to pick it up when you've got liver cancer or liver failure needing a transplant. You don't want to wait that long. You want to have liver function get your doctor to do regular liver function tests so that they can see whether, and that'll tell you your liver function tests will be abnormal if you have fatty liver disease. Okay. And does anyone know what foie gras is? It's a French delicacy that you eat, and it's fatty duck liver. Now, how do they get the duck livers to be so full of fat? What do they feed the ducks? Carbohydrates. They don't feed the ducks fat to give them a fatty liver. They feed the ducks grains and corn and starchy things. That's how you produce a fatty liver. It is just, I can't see why doctors, liver specialists just go, yeah, lifestyle changes, lose some weight. No, just cut out your carbs. It's a damn sight easier. Okay. So a lot of patients come to me saying, I've done the OzDrisk. It stands for the Australian Diabetes, I can't read everything because I've got things in the way, Type 2 Diabetes Risk Assessment Tool. And I'd like to read you a little bit of this because it is false. It's just wrong. This is an Australian government. You can just type in OzDrisk. You can go to the Australian government website and it'll say, what is type 2 diabetes? I'm reading this to you. I've printed it out because the information is false. So I don't want you to do this. Type 2 diabetes is a chronic long-term disease. No, it's not. Type 2 diabetes is a curable disease if you just cut out the sugars and refined carbs. Marked by high levels of sugar in the blood. Well, they got that bit right. They've got to get something right. It occurs when the body does not produce enough insulin. False. It occurs when the body produces too much insulin as a result of too much glucose. Or the body does not respond well enough to insulin. The body is responding perfectly well to insulin in order to protect itself. And it says, in order to lower your risk, eat high fiber cereal products every day and a small amount of fats and oils. No, don't eat any cereals. Breakfast cereals are garbage, even if they have fiber added to them. And you don't have to limit your fats and oils. There you go. And then it gives you a series of questions that asks you your age, your ethnicity, your family history, and then it gives you a score of how likely you are to have type 2 diabetes. I disagree that age is a risk factor. It's not age per se. It's just that you've been eating refined carbohydrates and sugars for longer than somebody younger. Okay, so how can you test for insulin resistance? There's no direct test, unfortunately. The most common tests doctors will do is a fasting blood glucose. So you turn up, you can't have anything to eat for at least 8 hours. They'll do a blood test and they'll go, your glucose is in the normal range. But it can be in the normal range at the expense of producing too much insulin. By the time you have abnormal glucose, it's too late. You've been insulin resistant, but maybe 10 years, but it's not been picked up. So you've had all that damage for going on for 10 years. The other thing they might do is a hemoglobin A1C, which tells you what your glucose control has been like for the last 3 months, but it's still too late. Much better is to check your fasting insulin. So when your doctor does the next blood test, ask for your fasting insulin. They're going to go, no, we'll just do the blood glucose. And you go, no, I insist on the fasting insulin and I'll pay for it if I have to. It's not expensive, but it's worth knowing because you want to know if your insulin is raised even in the absence of having eaten, because that's one of the first signs of being insulin resistant, that it's just constantly a little bit on the high side. But much, much better still is to have an oral glucose tolerance test. That means you get to swig this disgusting glucose drink, and then for the next 2 hours, every so often, every half hour or so, they're going to test your blood sugar. And if your blood sugar rises and then doesn't come down as quickly as expected, that's a sign that your body is now struggling, because when you haven't eaten, your glucose might be fine because the insulin is keeping it in control. But this is a big clue as to whether or not it's taking longer than expected for you to remove the glucose from your blood. But the best thing of all is to get the insulin measured at the same time as your oral glucose tolerance test, because then you follow the two and you will see if your glucose goes up and your insulin goes way up more than you expected, well, that's a telltale sign. However, your doctor won't do this. You're going to have to be really pushy and ask for them to do it and just say, I'm really worried that I have insulin resistance. Okay. So is insulin resistance curable? Yes, no, I don't know, but I hope so. Terrific. Good, true. Yes, it is curable. Happy days. And you also pretty much know how. I forgot to mention, non-alcoholic fatty liver disease, it's now called metabolic associated fatty liver disease because of its association with metabolic problems, i.e. excessive insulin. Okay, we know we can cure the insulin resistance. Can we also cure all that long list of things that I said insulin resistance can cause? Next poll. So are the corollaries of insulin resistance curable? Or is it, when I say curable, I mean without medication. Or is it too late to reverse diseases like type 2 diabetes, NAFLD, gout, erectile dysfunction? And the answer is yes. They're all curable. Unless you've got to the point of liver failure or liver cancer, all those things are curable. It's really good news. Okay, so what can cure all those insulin resistance and all those diseases? Yes, all three of the above, but let's do some caveats here. A sugar-free diet only if you're at the earliest stages of insulin resistance. Sugar-free alone, you can try it, but I think if you're in the early stages of insulin resistance, little bit of high blood pressure, not much else, little bit of excess belly fat, not much else. Maybe it's enough just to cut out the sugars, all the processed food, all the sugars, all the sweets. More than likely, you're going to need a low carb diet. And by extent, which we've talked about, but we'll talk about a little bit more. A ketogenic diet definitely can, and I will explain to you what that is in a moment. So all three of the above, but a sugar-free diet might be enough. The next step would be you'd ramp it up to a low carbohydrate diet. And low carbohydrate diet, look, in the studies can mean anything from 0 carbs to 100 grams a day. A ketogenic diet for most people means less than 20 grams of carbohydrates a day. So it depends on the severity, and it depends on the individual, and it depends on whether you're also weight training, for instance, strength training, for instance, whether or not, to what degree you have to restrict carbohydrates. So a ketogenic diet is just an extremely low carbohydrate diet. Okay, so let's get into a little bit more detail. A ketogenic diet is called that because your body, when you're eating this diet, produces what are known as ketones. Now, what are ketones? Ketones are produced by your liver from fats, from the fats in our food. Now, it will only produce ketones when your insulin levels are very low. When insulin is high, your liver doesn't need to produce ketones. What are they? They are an alternative source of fuel. So I told you that glucose was the chemical that's used for energy by all the cells of our body. That's true. But when there's no glucose around, for instance, when we're sleeping, we're not eating any glucose, insulin levels drop very low, and maybe after 8, 10, 12 hours, we start to produce ketones. That's if blood sugar levels drop that much, and if there's not a lot of fat stores, we will start to produce ketones to fuel our brain and the rest of our body while there's no glucose around. But if there's glucose around and if there's insulin around, the body does not produce ketones. The liver does not produce ketones. And the reason people are obsessed with ketones is because they are an indication that you're eating few enough carbohydrates to guarantee that you will reverse your type 2 diabetes, your insulin resistance, and all the things that go with it. But it's not the ketones. I think this is a really important point. It's not the ketones that are curing the diabetes. It's the low insulin, and the ketones are just a sign. Now, some people like to measure things. So there are only 3 ketones that the body produces: acetoacetate, which is detected in your urine, acetone, which is detected in your breath and can give you a sort of sickly sweet breath, and beta hydroxybutyrate, which you can only detect in your blood. So some people, you can buy dipsticks, which you can just test your urine every morning after every meal to see if you're producing ketones, and that'll tell you that you're eating few enough carbohydrates. However, after you've been on a keto diet for a couple of weeks, certainly a couple of months, you'll be excreting less because you'll be using more ketones for fuel. So urine is a good test in the early days, but after a while, you're going to go, hey, I'm not producing ketones in my urine anymore. That's because you're probably eating so few carbohydrates that the body's retaining all the ketones. Acetone in your breath, you will probably continue to produce throughout, but again, it's not as reliable as, and you have to buy a little machine that you breath test. And beta hydroxybutyrate is, you can either do a pinprick, usually just do a pinprick, and you test your blood all the time. Now, the machine isn't that expensive, but the strips are really expensive. So it's an expensive way to go. I think, by all means, just Google, measuring ketones and you'll get lots of options. But if you just keep your carbohydrates to less than 20 grams a day, I guarantee you'll be in ketosis and you won't need to measure. Now, the thing to note is, important points are, these are the arguments that have been presented against a keto diet. Now, I'm not saying you need to do, this is not the way you want to, if you don't want to give your kids a keto diet, this is a diet that is used to treat serious illnesses like insulin resistance, type 2 diabetes, high blood pressure, erectile dysfunction, and all those other things I mentioned. A lot of tests will test a keto diet for 2 weeks. Now, during that time, you are detoxing from carbohydrates. What happens to an alcoholic when they stop drinking alcohol? Are they bouncing up, full of energy, feel fantastic the day they stop drinking? No, they feel like garbage. They feel way worse when they're not drinking alcohol until they've detoxed. Well, the same with carbohydrates. If you've been producing so much insulin and eating so many carbs, you're going to have to detox. And you're going to get what's called the keto flu. So for 2 weeks, maybe even 3 weeks, you're going to feel like you've got the flu. You're going to have muscle aches and pains. You're going to feel lousy, tired, no energy, foggy brain, but that is just detoxing. And then after 2 to 3 weeks, you will have more energy than you ever had. You'll have clarity. Your symptoms will go. Contrast that to a condition called ketoacidosis. Now, this is when you've got too many ketones in your blood, and you'll never get that by eating a low carbohydrate diet. The only people who get ketoacidosis are type 1 diabetics who don't produce any insulin and don't give themselves a dose of insulin, and then their body has to produce so many more ketones in order to fuel their cells, and it makes their blood acidic, and that can be a life-threatening condition. But trust me, you will never achieve ketoacidosis just by lowering the carbs that you eat. Other people, you'll hear mentioned exogenous ketones. You can eat, you can buy them in a shop. Apparently they taste dreadful, but I don't see the point except in special circumstances, because remember, it's not the ketones that are curing the diseases, it's the low carbohydrates, it's the less than 20 grams of carbs. Okay. And some more essential points. This is more about how to stay healthy. You'll often hear there's in the health report just last week, they were talking about they can cure type 2 diabetes and lower blood pressure with an 830 calorie a day diet, a very low calorie, low fat diet. That's fine. But who can sustain 830 calories indefinitely? Nobody. So I would much rather just restrict carbs rather than restrict calories to such a low rate. And here's the clue. And this is why low fat can work, because you've got to choose. We were not designed to eat high levels of carbohydrates and high levels of fats, because no food in nature is high in both carbs and fats. The only foods that are high in both carbs and fats are the man-made ones, the processed foods and the snack foods. And yeah. So if you think about it, the only vegetable that is high in carbs and fats is an avocado or a coconut. But to compensate, they've got very, very high levels of fiber. So in fact, you don't absorb most of the carbs in those. You're just absorbing the fats. And proteins do come with fats, so no need to cut the fats off the proteins if you're restricting carbohydrates. You need those fats for energy. The minute you drop your carbohydrates, you're going to have to increase your fats because there's only so many more proteins you can eat before you're going to choke. Do you know what I mean? Like, you certainly need to eat substantial protein. I'd say a palm of protein with each meal, and make up the deficit with fat, not carb. And carbs in nature come with fiber and water. And that's why if you only ate natural carbs, as in no processed or packaged food or man-made food, and you just ate, fruits and vegetables, either raw or steamed or stir-fried, you'd be fine. You wouldn't get high, you wouldn't get insulin resistance. But the minute we overdose, that's when we run into trouble. And the other really powerful thing that will help lower insulin levels is that overnight fast. The longer you can go without food in any 124-hour period, the better. Because fasting is a very powerful way of, if you're not eating anything, you're obviously not producing any insulin, and you're draining the fat out of your organs. And one of the worst things we can do, somebody might say, but I don't eat that much, but they just snack throughout the day. Snacking, every time you snack, you're producing insulin. So the fewer meals a day, the better for a type 2 diabetic and an insulin resistant person. So, but I love my carbs. What can you swap them with? Lots of easy swaps. For pasta, spiralized zucchini. Steam it lightly or have it raw. It is absolutely delicious. You'll get used to it. Instead of having, if you love your hamburgers, your meats in bread, you can use lettuce leaves. I can also, if you want, email me. I can send you 10 different low-carb bread recipes if you must have bread. But you can also Google them. You don't have to ask me for them. Just Google. There's thousands of low-carb bread recipes out there. And a really great substitute for rice is your grated cauliflower, even grated broccoli, and really good substitute for potatoes, say mashed potatoes, is mashed cauliflower. So you can still get some of those carb feelings. If you want something more prescriptive, there's two things I recommend. Just Google Dr. Westman's page for, I think the last word is diet. It will, if you just want to follow a plan, it'll give you a plan to follow with just 20 grams of carbs a day. Just Google it. And it'll cost you $9.99 US, but it is a damn sight cheaper than a liver transplant and a damn sight cheaper than having daily insulin injections when you become type 2 diabetic. And if you want more detail, a great book is End Your Carb Confusion by Eric Westman and Amy Berger, Berger, but just End Your Carb Confusion book. If you want the detail, and they also outline in more detail than Dr. Westman's page 4 plan. If you want the details, they'll give you list all the keto safe or low carb vegetables and low carb fruits and low carb everything. Okay, so is low carb for everyone? We're getting to the end of our polls. I'm sorry I've gone over time, but we will finish very, very soon. Does everyone need to be on a low carb or ketogenic diet to prevent insulin resistance? So you understand that a ketogenic diet is just an extremely low carbohydrate diet where you're eating less than 20 grams of carbs a day, which is forcing your liver to produce substances called ketones, which act as an alternative source of fuel for your cells. Not to prevent it, because there are so many cultures around the world. I'm just saying, if you're from birth, you've been living in rural Japan, or you've been living a tribal life, or you've just been, maybe you're a Seventh-day Adventist, because they very pure, they don't eat processed food, they cook everything from scratch. Those people can just have, a mixture of proteins, fats, carbs in their diet, because they're all natural. They're not eating processed food. You probably won't ever run into trouble. So it's only once you get to the point where you've got symptoms, aches and pains, high blood pressure, starting to show signs of insulin resistance, then you will need a low carb or ketogenic diet. It has actually been found to be more powerful than any medication available for these illnesses. A ketogenic diet was the treatment for epilepsy before epilepsy drugs. And the only reason it dropped out of favor was because they thought, oh, well, if we give people drugs, then they don't have to cut their carbs, especially since it was children. And they had to supplement, if a child is not eating any carbohydrates, then they do have to supplement them with vitamins and minerals. But a ketogenic diet, if I had epilepsy, I'm telling you right now, I would be on a 100% ketogenic diet for decades. And they've actually found that after you have been on a ketogenic diet for 10, 20 years, you may be able to reintroduce a few more carbs and your epilepsy will stay away, because ketones have a different effect on the brain when they are metabolized and used as fuel than glucose. And I'm not going to go into all the biochemistry, but it has an effect on dampening down the overexcitation that you get with epilepsy. With Alzheimer's disease, as I said, type 3 diabetes of the brain, if I had known this when my father was alive, he would have been on a ketogenic diet. But we didn't know it then. The research was so raw and there was so much controversy. They have now done controlled trials where they've had Alzheimer's patients in hospital, and they have given them and I can send this to you too if you want, the ketogenic diet, which has been especially made so that the foods are going to appeal to an older person that might have trouble chewing and all of that. They have given people with Alzheimer's a ketogenic diet and a standard low-fat diet, and those on the ketogenic diet improved their symptoms. They scored better on memory tests, better on cognition after they'd been on this ketogenic low carbohydrate diet. I can't even remember it wasn't even that long. It was a couple of months, might have been 6 to 8 weeks only. And they found that it improved their symptoms. Same with Parkinson's. They're also finding that ketones and a ketogenic diet can help. Now, what I would have also done with my father, because it would have been hard with carers. Not everybody would have been on board. I would have, in his case, tried to supplement him with ketones, because the brain can't use the glucose. So his brain needs alternative fuel. So that's a case, remember I mentioned exogenous ketones. That is a case where I would supplement someone with exogenous ketones, or better still, because it's way more palatable, MCT, medium chain triglyceride oil tablets. And the liver can take the MCT oil and it converts it directly into ketones without you having to go low carb. So if you can't go low carb and you have Alzheimer's, take MCT oil tablets and try and cut down your carbs as much as possible. Okay, now I wanted to introduce you to the latest weight loss device. This is not a joke. Okay, if you don't want to listen to anything I've said and you think it's all too hard, I have an alternative for you. The University of Otago and United Kingdom researchers have come up with Dental Slim. It's a device that is implanted by your dentist, and it only allows you to open your mouth 2 millimeters so that you can stick to a 800 calorie a day liquid diet. Now, in case you try and cheat, which some of them did, by trying to drink melted chocolate or soft drinks, don't you worry, they have a safety feature. They've got this lock that you can unlock so that you can swallow or spit out, because if you cheat, you might choke. So there you have it. But I do have to end on a positive note, because I don't think that's a very positive thing. It looks like a medieval torture device, if you ask me, but nobody asked me. But look, this is what the human race is coming to. Need I say more? So, final question. Can you really lower blood pressure with a 6-minute, 5-minute daily exercise? I mean, really? If it sounds too good to be true, is it? The length of time you have to stick to it to various, I can't tell you, but it isn't as long as you think. As I said, the insulin resistance and type 2 diabetes can reverse within days. The liver will take longer, but it's not years. Could be, matter of months. Yes, you can. So what is it? If we remove that. So what is this amazing exercise? It is called Power Breathe. IMT stands for inspiratory, as in breathing in, muscle training. And what it is you've got this, you block your nose so that you don't breathe in through your nose. You could try this right now. Breathe in through your mouth as hard as you can. And then release. Now, so you breathe in through this device as hard as you can. And the device actually sucks air in the opposite direction. So it's causing resistance. So you're really having to work your inspiratory muscles and your diaphragm very hard in order to get the air in. You do 30 sucks, takes, in one session, takes about 5 minutes. So you go, 30 times, takes about 5 minutes, once a day, 6 days a week. They did the studies, and over a period of 6 weeks, everybody's blood pressure dropped about 10 points. That's a systolic blood pressure. That's pretty good going. That is better than medication. You can go online and at this point in time, I can't see that they're making them in Australia. But the moral of the story is not that you all have to go and get a Power Breathe, though I think I'm going to, just for fun. But at this point, I think they're only available from the UK, maybe the US. The point is, we can do so many lifestyle things to improve our health. So just improving the strength of our inspiratory. Oh, it's also been found to improve cognition as well, and they're not quite sure why. So there you go. So where to from here? My goal from the get-go has always been, always will be, to empower you. Education is more powerful than medication. It really, really upsets me that the medical profession is not about empowerment. Do you know, when I go and do continuing education, I've got to keep up my registration. So I've got to attend lectures and I have to fill out answers. And some of the time I have to put down the wrong answer in order to pass the test, because I know what they're expecting. Because they'll go, what's the first line? What's the first thing, you should advise somebody, what's the first line? They're going to say, what's the first thing you should advise somebody who has insulin resistance or type 2 diabetes? To lose weight. No, to cut carbs. The weight loss will follow. Do you know what I mean? To cut out sugar. What should you tell somebody with high blood pressure? The answer is going to be to cut salt. No, cut sugar. But the medical profession, I cannot understand why it's not recognizing this. I think it's such a big profession. It's hard to change the collective consciousness and things that have been believed for so long. And the other thing is too, scientists don't communicate quickly enough with doctors, and most doctors don't have enough time to pour through research day in, day out, which is why I don't work in a clinical practice all the time, because I want to stay up to date. But if I were working 6 days a week in a practice and spending 15 minutes a day with a patient, I would not know this stuff. It takes time to learn this stuff. So I'm trying to convey it to you so you can educate your doctors. I want this test. And if your doctor says, no, don't go on a low carb diet, let me just tell you, nobody died. Nobody got more sick from going on a low carb diet. Go back after a month, do the tests again, and I go, oh, fantastic. What did you do? I went on a low carb diet. Oh. So you will teach your doctor. And if enough patients go to their doctors and say, I tried this and it worked for me, maybe we're going to shift. So lifestyle, the choices we make every day, what we put into our mouth, and I didn't mention that I talked about low carb diets today because that is the biggest bang for your buck in terms of regulating blood glucose, insulin, and helping all those diseases. But if you add to that regular good night's sleep, aerobic exercise, strength training, meditation to manage your stress, you'll be laughing. You will be hitting the ball out of the park. So that's my goal, to empower you for you to know that there's so much you can do for you, and to try and spread the word as much as you can. You know, tell other people what works for you, and hope. We are all different, so each person is going to, you know, different foods are going to agree more or less with other people, but I'm giving you the foundations, and then you can experiment with the rest. So also, where to from here? I'm finishing my sequel this year, and I will be starting a podcast next year. So I will invite you all to listen to the podcast, where you'll be getting more great information to help you stay on track. So on a scale of 1 to 5, how useful did you find tonight's webinar? And it's the last one, so I was allowed to go over time.
Someone just wrote here, this is quite lovely. Thank you. This information explains exactly why I haven't been well lately. The more carbs I ate, the more I craved them. Knew I was eating too many carbs, and now I know how to cure it. I got a tear in my eye. That's awesome.
That is why I do this, and I'm so thrilled to hear that. And let me just make one other point. You brought up a really good point. People go, but I crave carbs all the time. And the less you eat carbs, and the less you eat the refined carbs, the less you're going to crave carbs, because you're not going to be producing the insulin, and you're not going to have the up and down glucose. And if you, the key to succeeding is not to fear fat. If you are dropping carbs, you are going to need another energy source. Yes, proteins can provide energy, but protein is too valuable. Protein is needed to build all the tissues of our bodies. Proteins are needed for enzymes and biological processes. So your body does not want to waste proteins for energy. They're needed for more important things. Fat, on the other hand, it also has structural roles in the body, but we can spare the fat in our bodies. So the body is actually looking to use up the fat in your body. And because fat produces a more steady, slow release, long-term supply of energy, you will not feel hungry if you are not making some, you know, if your pancreas isn't producing so much insulin. So, yeah, so yeah, the fewer carbs you eat, particularly the fewer sugars you eat, the less you will crave carbs. Let me just make one other point that occurred to me. A lot of ketogenic diets will use artificial sweeteners. Now, you'll remember from, I don't know how many webinars ago, that artificial sweeteners still cause you to produce insulin. Admittedly, nowhere near as much as the real thing. You don't get as much insulin. But to me, using artificial sweeteners is a bit like using a nicotine patch. Eventually, you want to get off that as well. But if you need, and if you're going to use artificial sweeteners, stevia or monk fruit, and you can get them both at the supermarket, either whether they're the liquid or the powder. But remember, they're still processed, and they still will, you'll still want sweet food. You're still acclimatizing your taste buds to sweet things. However, if you need a nicotine patch, that is fine. Okay, so I'm just letting you know, a lot of the keto and low carb recipes will use artificial sweeteners. Up to you whether you do or not. Thank you very much for your wonderful feedback, wonderful responses. It means the world to me, really does.
Thanks, everyone.
Dairy. Okay, as I said, your average milk has 4 grams of carb per 100 grams, and it's in the carbs are in the form of, so 4 grams of sugar, which is glucose, because it contains glucose and galactose in lactose. Okay, full cream milk, full cream cheese. The soft cheeses tend to have more carbs. So if you tolerate dairy, you're fine to eat and drink dairy. However, just be aware that if you drink 4 lattes a day, just work out how many carbs you're getting from your lattes. Choose your carbs. If you love your latte and that's how you want to spend your carb quota, that's fine. And don't worry about the fat in dairy. There has just been no study that's indicated that it is unhealthy. That's not to say some people are intolerant to dairy. There are some people. They either don't make that they either actually have a milk allergy, or they don't produce the enzyme that breaks down the lactose in milk, and so they're going to get diarrhea and not find it pleasant. But if you tolerate dairy, that's fine. Just be aware that your ricotta cheese probably has a bit more, say, carbs than your Jarlsberg or some of your other harder cheeses.
Yeah, ricotta has. I only looked at that today. Ricotta has a little bit more than feta, and feta has a little bit more, then tasty type cheese, and then feta's a bit less again.
Now, let me just do another warning. Always read the ingredients of your cheese, because there's feta and feta. I have picked up feta cheese and I thought, and it's got vegetable in it, especially Danish feta, which unfortunately is delicious, because I used to just get it cut off at the deli. And then when I found it in packets and read that they had vegetable oil in it, I stopped eating Danish feta. But yeah, so just be careful. Sometimes they add vegetable oils to cheeses. And some of the processed cheeses have artificial emulsifiers. And so cheese should just have milk and rennet, the enzyme that is used to make it.
Awesome. Helena, what an amazing way to finish. Thank you so much. The comments that are coming through, people are so grateful.
Nuts. Sorry, I just saw there was a question about nuts. Nuts are fine. They have protein, they have fat, and they do have carbohydrates. The nuts with the highest carbs are probably cashews, probably after that peanuts, which are not actually nuts but legumes. But generally speaking, if you just have a handful of nuts, they're fine. Like if there's something that you really like and you're going to eat a lot, just Google how many carbs in and put the food down, and you'll get a table, and it'll just tell you put in the food and you put in the quantity and you'll get the grams of carbs. So generally nuts are fine and accepted and used a lot in low carb diets. But you don't want to binge on anything, but nuts are still better than chocolate, ice cream, and all that kind of stuff.
All right.
Let's see, I think. All right. Well, thank you so very much, everybody. It's been such a pleasure. And till we meet again, all the best.
Thanks a lot.